Hello, Dr. Cisse covering anatomy and physiology. Today I'll be presenting about the spinal cord. This is the transverse cut of the spinal cord. You can see in the middle gray matter, and the outside the white matter. The gray matter looks like an H or a butterfly in the middle of the white matter. The gray matter is divided into horns. The horn on the back side, how do you know it's the back side? You look at the ganglia. The ganglia is always on the back side. It'll be the dorsal or the posterior. That's why the horn on the back side is called the dorsal horn or the posterior horn. The horn on the anterior side is called the anterior or ventral horn. The one on the side, on the lateral, is called the lateral horn. So we got three horns: dorsal horn, ventral horn, lateral horn. The white matter is divided into columns. Also, dorsal, lateral, and ventral. Dorsal column, lateral column, ventral column. If you look at the gray matter here, you see some wires coming out of the gray matter. These are called rootlets. Rootlets. So the one on the dorsal is called dorsal rootlets or posterior rootlets. The one from the ventral is called ventral rootlets or anterior rootlets. The rootlets will come together to become the root. This will be the anterior root, the posterior root. The posterior root has a ganglia. It's a bump, right? The ganglia is called posterior root ganglia or dorsal root ganglia. When the two roots come together, they become the nerve. So from here you have the nerve, you have the root, posterior root, anterior root, posterior root ganglia, the rootlets, the gray matter in horns, dorsal, ventral, lateral horns, and the column, dorsal, lateral, ventral column. In the middle of the gray matter, you have the central canal. Okay? So basically, gray matter, white matter, horn, 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 column, 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 rootlets, root, and nerve. Thank you for watching, and I'll see you in class.